We have a fact check. 'Tis the season for hot drinks, and go ahead and have that cup of joe. Coffee may be good for your heart and aging. This is according to 2 recent new studies this year. Family Dr. Nita Bijoor joins us now from Oakview Medical Associates in Greenville. So thank you so much for being here today.
Thank you for having me.
I had some chai today, but I do love my cup of coffee in the morning. This time of year, it's so cold out. Like this morning, it was 20 degrees. So anything warm is so nice. So tell me about this first study about why it's good for our heart.
Yeah, it's interesting because, you know, we always tell patients don't drink too much caffeine, so this is contrary to what we've been talking. So the first study is a randomized, double-blinded control trial. So what that means is they took about 200 patients, average age being 69 years of age. All of them had AFib and were either treated with medication or cardioversion, which is the electrical treatment for atrial fibrillation. So they were all in normal sinus rhythm, and then they were randomized to either 1 cup of coffee or 0 cups of coffee. So what they found is about 47% of those in the caffeinated group actually had a recurrence of AFib that lasted about 30 seconds, and 64% of the patients that had 0 cups of coffee actually ended up having AFib. So this means there's a 39% lowering of AFib in patients that had a cup of coffee.
Do we know why that happens?
I think there's a lot of factors that go into it, but one of the plausible things is caffeine actually can energize you, so maybe it does help with a little bit of your heart, cardiac conditioning. The other thing that is plausible is it's a anti-inflammatory compound, so maybe it helps with lowering cardiac inflammation. It also reduces oxidative stress because of all the plant-based chemicals in there. And so there are maybe some scientific things to this, but I think we really need to check with our doctors before you just start loading up with caffeine.
So that was just 1 cup. Okay, this next study, it was 3 to 4 cups. So this is about coffee and cellular aging. Tell me about this study.
Yes, so this one is an observational study. So they took over 400 to 500 patients from 2007 to 2018, and they looked at people with mental health illnesses, and they looked at the ones that had the sweet spot was about 3 to 4 cups of coffee. If it was over 5 cups, that did not show a benefit, and 3 to 4 cups of coffee actually showed a lengthening of the telomeres. So the telomeres are the ends of chromosomes. It's almost like the cap on the shoelace, and so a longer telomere is known to be protective against aging, cellular aging. So it showed longer telomere length, and I think that's interesting. They also, have found that telomere fraying or shortened telomeres is linked with cognitive decline, a lot of neurodevelopmental issues down the road. So I think, it's looking at how that helps reduce cellular aging overall.
Do you think 3 to 4 is too much? That sounds like a lot to me.
I mean, I, have tea, and I have usually 1 or 2 cups. So I think you need to check. If you're already a heavy coffee drinker, then you do need to check with your doctor, make sure that you're not just, in the name of these studies, just going on and overloading with that, because any stimulant can raise your blood pressure. It can have other side effects. Coffee is also a diuretic, so maybe it just helps get rid of a little bit of extra fluid. But all of these people are on multiple medications, so you must check with your physician.
And I know coffee can dehydrate you, and some medications can dehydrate you.
Correct.
So that could be a bad concoction there, right?
That's true, yeah.
All right. Well, thank you so much for joining us and breaking all of that down.
You're welcome. Thank you.